Girls, hi,
Yes,
good
ma'am.
morning.
Good morning, ma'am.
Good morning, good morning. So, did you do the activity? What I gave yesterday? Okay, so we'll start now. Shaman. This is also just a basic one, like yesterday's one. So, this is a lecture 8. Lecture 9 is a bit hard for you all to understand. So, we'll finish this quickly and then move on to the lecture 9. Um, So, creating a positive learning environment. So, today our topic is what we are going to learn is creating a positive learning environment. So, as the introduction, learning environment influences child development. So, you know about child development, right? So, what includes in child development? Physical, yeah, physical, social, emotional, and cognitive. So, after that, the theories of child development. Like I gave you a chart last week Wednesday, I guess, right? Yeah, Jean Piaget, Lev Vygotsky, Erik Erikson stages, and yeah, even Powell, the operant conditioning and everything. So those are like included into child development, right? So children learn best in safe and supportive spaces. So positive environment in the sense it is moreover like a better participation as well. So our learning objectives for today will be define learning environment, understand emotional safety, explain role of play and exploration, and how are you going to apply teaching strategies to this positive learning environment. Okay, so what is a positive learning environment? So physical, emotional, social setting. So includes classroom setup and interactions, affect behavior and learning. So in positive learning environment, positive learning environment. So this is one. So it divides into one positive, emotional, and social. So in learning environments, okay, in learning environments, what does it include in his physical? Sorry. What does it include? In environments, running, walking is like in children, right? So in positive learning environments, what are some physical aspects? Online students, you can also answer. What are some physical aspects in positive learning environment? Girls, motivation. Start with our part. Online students, what are some of the aspects of positive learning environment? No.
ஒருவருக்கு எப்படி ஹெல்ப் பண்றதுன்னு சொல்லி கத்துக்கொள்றது அந்த மாதிரி.
if a or a children எடுத்தா like ஒரு kid எடுத்தா அதோட physical இது வந்து like running அப்படித்தானே running crawling walking அப்படித்தானே physical aspects வந்து so environment பத்தி நான் கேட்கிறேன் யூஸ்வலா environment surroundings பத்தி என்னென்ன physical aspects இருக்கும் அப்படி as you said running all those will come in one thing in one what is that no not activities it's like we can say it like a biological fact so by running walking eating jumping it's affects one aspect of our life of our body right health yeah so health in that you can say like running jumping skipping whatever and then and then health we can say has one of the physical factor with all including health right yeah so after under the health you can write like for an examples running walking like explaining like or you can draw charts or you can explain like that yeah you can so after health you can say about safety. Safety has a physical factor. Safety, like from environment, you are safety. So in emotional side from environment problems. Emotional emotional side in the sense it's all about emotions, right? So for emotions you can write problems, happy, sad, those everything, right? So in social, what is the no. It is also about like interactions. No. But exploring in group activities in podcast. Exploring in group activities. characteristics of a positive environment: safe, inclusive, supporting, engaging, and respectful. So, in a positive environment or in a positive classrooms, these are some characteristics that you might follow. Okay. You bought a book today? No. Ah. Hmm. Exploring in group activities. Okay, done. So importance of a positive environment. So builds confidence, improve participation, support emotional well-being, enhance learning. So when you are in a positive environment, apart from a negative environment, when you are in a positive environment, like in positive classrooms, like positive family backgrounds, positive cultures, so that positive environments, you can have a confidence within yourself, right? With a positive environment, so you can improve your participations as well, and supports emotional well-being and enhance, it will improve your learning as well. Okay. So, and then emotional safety. What is an emotional safety? Feeling secure and accepted, free from fear, and respectful environment. Why emotional safety is important? Encourages participation, builds confidence, promotes risk taking in learning as well. So, in emotional safety, what are some of the aspects that you should have, girls? Confidence around, yeah. Feelings, yeah. Hmm. Yeah, 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 same. Hmm. So, when we talk about emotional safety, there is like positive emotional safety and negative emotional safety. So, for positive emotional safety, we can say like in confidence, happy, those everything. So, in negative emotional safety, we can tell like abuses, repression, those everything. So in abuses, of course, they are acting like a negative thing for us, right? Not a positive thing for a girl. So it's about a negative thing. So it comes under negative emotional safety. Yeah. Do you want me to draw a chart for that also, like emotional safety, positive emotional safety and negative emotional safety? Huh? No. Do you want me to draw like that? For your knowledge, I mean. So for positive emotional safety, can you tell me more? For positive, what is it not? Who motivates today? From morning onwards, she was like motivation. This motivation. This motivation. She was like that only. Ah, that's why. For negative, depression, abuse, and we can say instead of depression, mental disorders. That's not a problem. Like, you can see that like negative problems. So it's like for negative problems, it's linking to mental disorder like anxiety, depression, and everything. So it comes under mental disorders, however. Suicidal thoughts. Can I put a picture to the book? What is that last social thoughts? Suicidal. What? Suicidal. Suicidal thoughts. And then supportive environment. So encouragement plus guidance is there in supportive environment, and equal learning opportunities is also there, and respect for all students. So in a positive environment, in a positive classroom environment, you have to encourage them, guide them, and give the equality for all of the students, and respect all of the students as well in a positive learning environment to create a positive learning environment. Okay. And teachers' roles of this environment is to guide, support, and motivate. Okay. So play and exploration. Role of play. So I taught you about play-based learning, right? So the role of play is natural way of learning, develop social and thinking skills, and make learning enjoyable. Okay. So types of play. There is like free play, guided play, and role play. What is free play? Free விடுறது என்ன வேணாலும் பண்ணு So what is guided play? Someone who's guiding. So what is role play? Taking roles. Yeah. Hmm. Okay, let's see what is wrong. So, and then exploration. So, learning through discovery, hands-on experience, and encourages curiosity. So, you know about exploration, right? Exploring something. Like புது புது ideas நாங்க explore பண்றது, நாங்க கத்துக்கொள்றது. Okay? By seeing something new, we learn from that, right? இதுதான் இது, like that. And benefits of a positive learning environment would be creativity, confidence, and independent learning as well. So, thinking skills, curiosity, desire to learn, ask questions, explore ideas. Curiosity in the sense desire to learn. Do you know about desire to learn? Like, what is desire to learn? Desire to learn. What is desire? Yeah. Desire சொன்னா ஆசைப்படுறது அப்படின்னு சொல்லலாம். Desire to learning in the sense, no. Desire means like a wish, like a wish. No, that's expectation. எதிர்பார்ப்பு வந்து
விருப்பமானது
ம்?
விருப்பமானதை படிக்கிறது
Eager to learn.
விருப்பமானதை படிக்கிறது
Yeah, அப்படியும் சொல்லலாம். Like desire to learn என்ன learn என்றா like படிக்க ஆசைப்படுறது.
Eager to learn.
Yeah, eager to learn. படிக்க ஆசைப்படுறது. ஆசைப்படுறதா இருக்கட்டும் லைக் அந்த படிக்க இதா இருக்கும் நான் படிக்கணும் நான் இது பாஸ் ஆகணும் யா அது ஒண்ணு இருக்கும் தானே லைக் அது so we can say it as like a wish to learn eager to learn அப்படி and ask questions and explore ideas so for an example what will happen if questions so இந்த மாதிரி questions எல்லாம் curiosity ஆட்கள் ரொம்ப கேட்பாங்க படி படிக்கிறதே ஆசை நான் இது பண்ணணும் நான் அது பண்ணணும் yeah yeah எக்ஸ்ப்ளோரேஷன் வந்து புது 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 ஐடியாஸ் நாம வந்து எக்ஸ்ப்ளோர் பண்றது கிரியேட் பண்றதா இருக்கும் புது புது லைக் when we are like seeing a new thing we are like get to know that right what is this this is that like if you are like coming to Colombo you have you seen that Lotus Tower. So you know what? This is Lotus Tower. There is blue. There is pink back. There is black in the tower. You're like exploring, right? So that is like exploration. So சின்ன பிள்ளைகளுக்குலாம் like explore நல்லா பண்ணலாம் like இதுதான் இது கம்மா என்னது ஆன்ட்டி என்னது இது அப்படின்னு like they want to know that new things, right? So creativity, of course, you know about, right? So imaginations and expressions, art, storytellings, and role play. For an example, so free drawing and creative activities. Problem solving, analyzing information, decision making as well. So for an example, build a tower that won't fall. So that's a creativity idea. And the role of teachers. Facilitator in the sense guide பண்ற மாதிரி. Okay, so guides learning and support students. So you have to act like a facilitator, like observer and a motivator as well in positive to create positive learning environments. You have to like act as a facilitator and observer and a motivator as well. So as a facilitator you have to guide students and support students as well. So as an observer, you have to understand the students' needs and you have to look after their behavior as well. Okay, you have to monitor that. And as a motivator, you have to encourage their participation and encourage whatever they are doing, like the good things. Like if a kid is like about to help another kid by giving a pen or giving an eraser, you have to encourage them. Oh, good job, like that. Okay, as a motivator. So it builds confidence for them. Like they did a great thing, they did a good thing. It builds a confidence for them as well. So that's it about positive learning environment. Positive learning environment in the sense it's moreover important for your teacher training one. So yeah. So activity one and activity two. There is activity one and activity two. So online students, is there anything that you can understand? Sorry, you didn't understand?
No, no, ma'am.
What about Nasli and Shamla? Okay. So it's easy, right? Positive learning environment in the sense it's easy. So now you can do the activity one. What? Oh my God, wait. Nusra and Shimla,
Yes.
you are coming tomorrow for the exam, right? Sure.
Inshallah. Sorry.
Inshallah, illa exam una varanum thane.
Varam, teacher.
Okay, okay. What about Shimla? Shimla, Shimla,
Yes, ma'am.
you are coming tomorrow, right? Sure.
Yeah.
Yeah, okay. So be there at 9:30 sharp. What? Why? Nusra and Shimla,
Yes, ma'am.
bring two full scaps while you're coming tomorrow for you.
Okay.
Rista only.
Nusra, okay?
Okay, okay.
Okay. So for the essay, there is MCQ 20 questions. Okay. Yeah, I can remember. So there for MCQ there are 20 questions, and section B is like this: answer the following questions. There is like 6 questions, and section C is scenario based one, and section D is the essay question. So essay. So for the essay, yeah, choose. There are 4 questions. You have to choose 2. So for the essay, look after about the theories of child development, and yeah, you have to explain every theory, right? Like if you, yeah, theories. Yeah. From the behaviorism, yeah, from the behaviorism, you have to explain what for theories. Yeah. So about child development and learning theories. So the lecture 6. No, everything you have to explain. Lecture 6, theories of development. So that, and as I remember, yeah, as I remember, for behaviorism and everything, there is a lecture 2 about learning theories. Learning theory, lecture 2 or 3, I can remember correctly. And for sections, there will be theories of development. And as I remember, you can write about assessments. I put that sections also. Okay, so if you are writing like assessment, you have to write like an essay, because it's an essay type questions. You have to add the huh? Half of the page. How can an essay come half of the page? Yeah, essay in the sense. You have to explain with examples. You can draw diagrams or examples or any of, like, it's your wish. Explain பண்ணணும். நீங்க ஒவ்வொரு இது எக்ஸ்பிளைன் பண்ணிக்கிட்டு போனா அதே ஒரு like 2 pages கிட்டத்தட்ட வரும். புக்ல பாருங்களேன் எவ்வளவு எல்லாம் வருது. Theories of development. Wait, I can do. There are 4 sections, and look after about this, that training and development. Those lecture slides, training and development. About training, I thought about it's lecture 3 or 4, as I remember. So yeah, I'm telling about the essay. So there is assessments, training and development, theories of development, and I'm helping you guys. Online students, you can also take a note. Okay, if you want to about the exam.
Okay, ma'am.
So you have to discuss the learning theories. Learning theories of development. Yeah. Learning theories and the theories of development is same. Like the lecture 2 and lecture 6. So you have to explain what are the theories included in the early childhood development. So learning theories and the theories of development. Whatever there is in the early childhood education, you have to explain. Okay? Yeah. No. Yeah. You have to write, and you can also write, if you want, you can also explain about who introduced the theories. If that's Jane Piaget, for an example, this is introduced by Jane Piaget, and you can write who is Jane Piaget and what are the stages he introduced about and everything, and expand your essay. So you will get more marks by introducing those everything. Okay. So, and you can add the charts, examples as well. And the second one is about, as I said, the training and development lecture. lecture slides, and you have to look after about evaluations, feedbacks. Yeah, evaluation, feedbacks. Yeah, feedbacks and everything, constructive feedbacks and everything. Yeah, relevance and everything. So those are in the training and development lecture slides, as I remember. Yeah, lecture 3 or 4, 3 or 4, 3 or 4, and I told you about educational psychology, right? Educational psychology. So yeah, there is this educational psychology as well. Yeah, say time. So section A is MCQ. Section B is like this: answer the following questions. Answer the following questions. Yeah. And study about the motivation in strict and extrinsic. So in strict and the internal environment aspects. Extrinsic and the external environment aspects. No. This one. Answer the following questions. So for section B also, it's around like there are 6 questions. Internal and external environment is in strict and extrinsic. It's also there under the motivation slides. No. What? How can that be? So there are 6 questions in answer the following questions. So for one question, 5 marks. So to get that 5 marks, you have to write about a lot, right? So you have to include the examples and whatever is there. Not like one sentence definition. No, it's not enough. It's not enough. So you have to, in section B also, you have to explain it with examples. So it's like answer the following questions briefly. So you have to explain that in brief manner. You can add like real life examples or examples, whatever, as you wish. Okay. So section C is scenario based ones, as we did. No, scenario based questions we did. Scenario, yeah. Yeah, I will give the scenario to you and I will ask 2 or 3 questions from them. You have to answer them. So if there is like explain, you have to explain it briefly. In scenario based also, if there is anything like explain briefly, you have to explain it briefly as well. Okay. Recording the live. Okay. So section D1, the segregations. So answered any 2 into 50. So one section is 50.
Yes, for you said in one of the stages, only one question talk about each stage.
Only one.
Only for MCQ.
Yeah, only for MCQ. So for if you are selecting the sections of child development and development theories, you have to explain. If you are taking down Eric Erikson, the psychosocial theory, it should be there. If you are writing down that, if you are able to introduce the Eric Erikson, you have to introduce those 8 stages as well. It's easy, right? With examples as well. Autonomy was a shame. Initiative versus guilt. நான் எல்லாம் அதுல presentation செஞ்சு எரிக் எரிக்சன் ஸ்டேஜஸ்ல by keeping remember and everything.
And then if we explain the 8 stages, I believe you can get 4 points.
Yeah,
But
yeah.
if
If
you
you
get
no,
no problem.
so explain everything as you can. So exercise எல்லாமே print out எடுத்துட்டீங்களா? சிக்ஸ் வரைக்கும் எல்லாமே ஆ up to 6 take and keep, so you can study the. So I gave notes in training and development, right? Yeah, right. Yeah, that's right.
If we score no, what will you do?
It's nothing to do, but however, it's up to you. You know about like what stage I'm in, what yeah, the knowledge and everything, how which yeah, which things I need to improve and everything.
Yes, Saturday, no class or
Yeah,
no class or
why?
we score. But not.
You have to stay at home. Online students, do you have any questions about the exam? You have to go. Yes, from lecture 1 to lecture 6, everything will come.
how does play support children's learning? We can write benefits.
Yeah.
This one, that's all.
Those who are joining online tomorrow, Gino, Mesha, and Riska,
Yes, ma'am.
uh,
Yes, ma'am.
yeah, so you two both want to on your videos for
Okay,
tomorrow,
ma'am.
only
Okay.
for tomorrow,
Okay.
while writing the exam. Okay.
Okay,
Okay,
ma'am.
ma'am.
Online students, take your break now and come back at sharp 11:30. Okay?
Okay, ma'am.
No, no, 11:30.
Okay, ma'am.
Okay. I hope everyone is there on the students. Yeah. So we'll start the second presentation for the day today, and so addressing special needs and challenges in learning. So do you know what special needs? What are special needs? No, no, they are not abnormal. Yeah. There are development delays and everything. Okay. So here, every child learns differently. Some children require additional support. Teachers must identify and respond to diverse needs. So our learning objectives for today will be, wait, okay. Define special needs, identify learning difficulties and disabilities, understand inclusive education, and explain collaboration with families and professionals as well. So today we are going to learn about special needs children. So what are special needs? Special needs is a broad term for individuals requiring assistance for medical, mental, emotional, or physical abilities or learning difficulties. So these needs require specialized services, accommodations, or support in education, in daily activities, or healthcare. It covers a wide spectrum, including autism, ADHD, physical impairments, and mental health challenges. So, special needs in the sense, these special need individuals needs an assistant. Okay, so for an special need kid who is like diagnosed by autism, ADHD, and any like physical disorders, anti-reflex hyperactive hyperactivity. ADHD is hyperactivity, and anti-defect hyperactive disorder. Anti-defect anti hyperactive disorder. So for those individuals, for those kids, there is one thing called special needs, which is you have to support them. Okay, so these needs require specialized services. So there for special need children, there are various kinds of special needs schools and special need nurseries and accommodation for hospital services also. There is a special ward for special needs children in hospital also. Okay, and there is I don't know whether do you know about shadow teachers. Yeah, in Montessori's, in special needs schools, they are hiring shadow teachers. So the shadow teacher has to be with the child, like in during the school hours. Yeah, for the special need child, there should be a shadow teacher who is helping the support and everything. So here, special need children. Defect hyperactive disorder. So key categories and examples. So cognition and learning, which is like specific learning difficulties. Dyslexia, dyscalculia, and ADHD. So dyslexia and dyscalculia and ADHD is some of the learning difficulties. Okay, so So I have given you the meaning in down. So dyscalculia is neurodevelopmental learning disorder affecting a person's ability to understand, remember, or work with numbers and mathematical concepts. Okay, so dyscalculia and like அந்த ஒரு பிள்ளைக்கு வந்து அண்டர்ஸ்டாண்ட் பண்றது, ரிமெம்பர் பண்றது, லைக் நம்பர்ஸ் கூட ஒர்க் பண்றது, கால்குலேட் பண்றது, அதெல்லாம் கஷ்டம். அதுதான் டிஸ்கால்குலியான்றது. அண்ட் டிஸ்லெக்சியான்றது லைக் லேர்னிங் அபிலிட்டிஸ்ன்றது ரீடிங், ஸ்பெல்லிங்ஸ், ரைட்டிங்ஸ் அப்படி. ஸோ மேத்தமெட்டிக்கல் காம்ப்ளெக்ஸ் கான்செப்ட்ஸ் எல்லாம் வரும் டிஸ்கால்குலியான்ட்டு. டிஸ்லெக்சியா வந்து ரீடிங், ஸ்பெல்லிங், ரைட்டிங் அப்படி அந்த லேர்னிங் டிஃபிகல்டிஸ் வரும். ஓகே. And ADHD, you know, like hyperactive. Dyslexia means language-based learning difficulty. For an example, reading, spelling, writing. Dyscalculia mean okay. Dyscalculia in the sense he or she can't understand or remember or work with numbers and mathematical concepts. Mathematical concepts. He or she can't understand, remember, or work with numbers and mathematical concept. Dyscalculia வந்து mathematical concepts, அதே மாதிரி dyslexia வந்து reading, writing அந்த மாதிரி language problems. Okay, so communication and interaction, autism spectrum conditions. So do you know what is autism? I taught you, right? Yeah. So for autism kids, they can't speak, right? They will speak like only like one word, and they used to sit very isolated, right? So very alone. They used to sit like very alone in a corner, and they used to like watch something in the phone, or they doesn't like to interact with others. Those are autism. Okay. And speech language delays. So speech language delays may be affect for this dyslexia, dyscalculia, and autism as well. Okay, so these are some of special needs and disorders as well. Okay, so social, emotional, and mental health. So anxiety, depression, emotional behavioral disorder. You know about anxiety, depression, right? Yeah. And physical and sensory. Blindness, deafness, mobility impairment, and epilepsy. Do you know about epilepsy? Epilepsy in the sense seizures. Yeah, seizures, yeah. Epilepsy. Hmm. Physical and sensory தானே. அது சென்சரி மூலமா தானே. Yeah. அது மூலமா தானே அவங்களுக்கு வந்து அந்த ஃபிட் எல்லாம் வரும். Yeah. Tongue? Yeah. They used to laugh. Then? Not seashell. I said seashells. Seashells in the sense fit varadu. Fits varadu. Not seashell. Seashells. No. அது எப்படி இதுக்கு வரும்? No, seashells in the sense fit varadu. madiri. Not she sells, it's she sells. So, yeah. Not she sells, okay? It's she shells. She shells in the sense fit maramatari. So importance of early identifications. Early identifications and the special need disorders எல்லாம் வாரதுக்கு முன்னாடி earlier நாங்க like identify பண்றது. Okay, so early supports improve outcomes, prevents academic delay and builds confidence. So early support improve outcomes in the sense இப்போ imagine that a kid has autism and he or she he or she is like around 10 years. Okay, yeah, 10 years of all, and he or she has autism. Okay, and at the age of 10, that girl can't speak, right? She can say, right, amma, pa, teach, only one word only. And she used to isolate herself, like going to a corner and sit and wait and do her work alone, right? He doesn't want to interact with her. He doesn't want to involve in group activities as well. So if the parents identify this girl has autism in the age of 5, that can be cured. Yeah, 10 years and too late, like 6, 7, 8 madri, like you should figure it out what my child has updated. Therapies, physiotherapy, and like if there is a physical impairment we can say, but we have to do psychological therapies. Counseling, no, not counseling, like speech therapy, play based learning, adellame, like, and academic support, adellame kodukkanum. Like speech therapy, and you have to taught them one by one, from one word to one. So that one word அவங்க இப்போ நீங்க வந்து டேக்னு சொல்லி தாரீங்க. Week 1 டேக்னு சொல்லி தாரீங்க. This is the word, like you are giving a pen to him, and he is taking this, and that is take. You should explain that, and that அந்த concept வந்து அவங்களுக்கு புரிய ஒரு மாசம், from 1 month to 3 months. Yeah, from 1 month to 3 months between and the gap எடுக்கும். நம்மள மாதிரி like இது இப்படி take அது அப்படி, like no, yeah, அப்படி படாது. Like அப்படி படணும்னா we should like tell continuously, take, 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 take. We should give them that concept continuously. So only if we do that, only he can remember that. So parents won't do continuously like that, right? Every parents has their own work, so they don't have to write, like, they don't have time to like explain this and tell continuously. Yeah. So okay, that's belong to autism. So autism kids is like that. Autism. Abnormal. So are they like doing medicines, therapies? No, nothing worked. Hmm. Uh-huh. So same blood. My God. So common areas of support. Individualized education programs. So this tailored learning goals in school and adaptive technology. Tools to aid communication or mobility. Therapies such as speech, occupational or physical therapy. Therapy, I talked about therapies, right? The speech therapies, the occupational therapies, and physical therapies. So individualized education programs, in the sense, in special needs schools, they used to keep some programs once a week. Okay, so really, special needs schools, yeah. So there are a group of members like psychologists, therapists, those souls, and they used to keep one, like a workshop for one child once a week. So that is individualized educational program. So that is fully based on academics, not like therapies or anything. That workshop is fully based on academics. So they used to teach them about, like, if he or she is a toddler or preschooler, they used to teach about like A, B, C, D, and everything. Like, yeah. So adaptive technology tools to aid communication or mobility. So tools to aid communication, in the sense, now I told you about the give and take, right? The give and take concept. So now I am using a tool. The tool is the marker, right? So I'm giving that boy this and introducing the concept give and take. So my tool is the marker. So role of teachers: observe students, identify challenges, provide support, and collaborate with others. Identifying learning difficulties. What are learning difficulties? So challenges in reading. Yeah, what has happened? Writing, maths, memory, and attention. Can't make that. Okay. So those are some learning difficulties. So kids are challenging, right? Like in maths, in reading as well. So special needs children are moreover doesn't able to understand these things. So common signs, difficulty following instruction, poor concentration, slow progress, difficulty remembering information. So for an example, a child struggles to recognize letters despite repeating teaching. So this is like for just imagine a kid is about 12 years of old. Okay, so that 12 years of old kid should know how to read, right? How to read and how to behave and how to do the mathematical problems and everything. So if that 12-year-old kid doesn't know how to read, doesn't know how to solve a mathematical problem, so that are like common sides of a special need children. Okay, so if a child is facing difficulty in reading, writing, and everything, language based difficulties, so what is that mental disorder? Language based difficulties.
Dyslexia.
Huh?
Dyslexia.
Dyslexia. So if a kid is facing difficulty in solving mathematical concepts, what is that mental disorder? Dyscalculia. Dyscalculia. Yeah. Dyscalculia. Dyscalculia. So if a kid doesn't speak, only speaks about a one word and used to isolate their self, what is that mental disorder? Autism. She never answers it. You. Observation methods. So classroom observation, student work review, and communication with parents. So these are some of things that you have to observe. Okay. And the other thing is disabilities. Disabilities is a complex interaction between a person's health condition. For an example, cerebral palsy, depression, intellectual impairment, and environmental barriers. It involves limitation in the body or mind functions that hinder full social participation, encompassing physical, sensory, and cognitive impairments. Synonyms include impairment, dysfunction, and incapacity. So disability is the interaction between a person's health condition. Like it affects the physical, emotional, social, and cognitive as well. Okay. So according to the special need disorders, what are some of that includes in the cognitive development? No, the disorders I mean. Now I told you about 3 disorders. Now, just now, autism and dyscalculia and dyslexia. Yeah, 3. And the other 4? ADHD. I said about hyperactive, right? So from those disorders, yeah, ADHD is a disorder. ADHD is also a disorder. From these 4, what is affecting the cognitive development of a kid? What would affect? From these 4 mental disorders, 4 mental disorders சொல்லிருக்கேன் தானே, அதுல எது cognitive development affect பண்ணும்? Only dyscalculia. Dyslexia. Hmm. Hmm. Yeah. Hmm. ADHD வருமா? So that's what that's a physical, that we can say has a physical disorder, right? So அவங்க வந்து நாங்க நடக்கிற, like if we are like walking in a path about like how can I say, like in speed எப்படி சொல்றது, like if I'm walking in a path like in சும்மா சும்மா நடக்கிறது, like not ஸ்லோவா நடக்கிறது இல்ல, ஹைப்பர் ஆக்டிவ் அவங்க வந்து அப்படி நடக்க மாட்டாங்க. They will go like shum அப்படி. Yeah, they will run here and there. They won't, yeah, express, they won't sit in a place even in 1 minute. They want to roam everywhere, they want to run everywhere. That is hyperactive. Psychology disorders பத்தி, like if we like study about psychological disorders, அதுல பாதி வந்து எங்களுக்கு இருக்கும். Yeah, believe me, it's the truth. Like I have studied about all the like the psychological disorders and everything. Like I myself now I am imagining, oh, I have this, I have this, I have that. Update. So next one is cerebral palsy. So cerebral palsy is a non-progressive neurological disorder caused by brain damage before, during, or shortly after birth, resulting in permanent motor, muscle tone, or posture impairment. So brain, yeah. Cerebellum, medulla. Medulla here. Cerebellum is, yeah, cerebrum is here. Cerebellum is this over there, and medulla is here. Yeah, from so so for biological, we have to study everything about brain. We have to study everything about brain. Yeah, biological things. And for masters, science. So for masters, we have parts like neurological, psychology, those kinds of parts. So if you read bachelor's degree. But yeah, BA, yeah. ಇಲ್ಲ separate ಅವಾಗ. Yeah. So yeah, ಇಲ್ಲ ಅದು ಬೇರೆ ಅವರು. So you have about 30 to 50 mental disorders you have to study about that. Yeah, in psychology. Adana, adu padiche, like I know, okay, I have this, I have that. My family members has this, my friends has this. Nobody. Yeah. Oh, I can understand you both. Yeah. Mm. Mm. Yeah. That's her problem, so that's her problem then. So by studying psychology, like by achieving a degree, you can go for counseling side. You can come for lecturing side. You can go about special needs like speech therapist, occupational therapist, and yeah, like into sports sides, into business side, into like HR and everything. There, yeah, there are very many career pathways too. So now I'm doing lecturing. So before that, I worked under occupational therapist, speech therapist, behavior therapist for kids, for special needs kids. So I worked there. Yeah, in Lady Ridgeway. Yeah. So after that, I was like, I can't, no, I can't. There is like a limited period of time you can see a child, right? For a long period, yeah, for a long period of time, for a long period of time, you can't, yeah. Hmm. Yeah. Yeah, for a long period of time, I can't. I can't bear that. So I was like, I can't breathe. And then the lecturing for cons then. And I have an idea to do a counseling also. But cons. And I'm trying for HR pathway also, like in business and everything. I have to see. Yeah, yeah. Yeah, but I mean business in business HRs, not in hospital. Yeah, yeah, but I don't like I don't like that. So yeah, business. Yeah, that's it. But very rare. Yeah. Okay. So, cerebral palsy in the sense they have a brain damage before, during, or shortly after birth. Okay, from birth, their brain is damaged, right? So they can't like talk, they can't do their activities from their hand. Like now, as adults, we can do our own activities, right? Now, as cerebral palsy kids, they can't. Like they can't walk. They need the support to walk also, right? So, depression. So, depression is a common serious mental health disorder characterized by persistent sadness, low mood, and loss of interest in activities lasting at least 2 weeks and impairing daily functioning. So, if you had these symptoms around like 2 weeks, please go near a doctor and see if you have depression or not before like going into suicidal thoughts. My request is please go near a doctor, or like if you need to go like to counseling. Okay, okay. Message me anytime. I'll reply. So these causes include biological, genetic, and environmental factors such as brain chemistry changes, trauma, or stress. So stress can cause depression in biological factors, in genetic, in environment, or like in trauma. This can causes trauma in the sense a long-term problem, a long-term problem that's still in your brain, like you're affected from that problem, right? Yeah. So imagine that you saw something related to now like a family problem. In your childhood, you saw your father hitting your mom. Okay. So that remembers even in now, even in like age of 16, 18. For yeah. Now, and you are fear of that. Okay, this could happen again. This might be happen again. Like this. Okay, you have fear about that. Mm. My God. Key types and examples of disabilities. So, physical disabilities, impairments affecting mobility or physical functioning, such as cerebral palsy, muscular dystrophy, and amputations. So muscular dystrophy is a group of diseases that cause muscles to become weaker or lose mass over time. So in kids who had like cerebral palsy, their muscles become weaker. And the attack to pain yeah, not like that much, but now we have muscles, right? So the cerebral palsy kids doesn't have muscles. There's like attack very attack. Like we can hold like this the hand. I have handled a cerebral palsy kid. Yeah, I have I have like I have done treatment for cerebral palsy kid who is around 15 years of old. She looks like 5 years of old kid. Avalo chinna. Yeah. It's affect the height, weight, and every physical really? Yeah. அவங்களுக்கு வந்து brain ஏதாவது damage ஆகுதா? அப்ப cerebral palsy இருக்காது. But other disabilities வந்து diabetics என்ன like medicines எடுக்கறாங்களா like insulin yeah, like tablets are like அது குறையும். That's what. Insulin என்னமோ தெரியல like it's in like humalin 30 or 60 brown. So if we can't like cure from that is because of diabetics. Yeah. So diabetics. So that kid who I did the treatment, so he looks like around 5-year-old kid, that weight, that height, but she is like 15 years old now. So her one side of brain can't work, only one side of brain can work, only one side. Okay, it's like as I remember, the left side can work, the right can't work. From the brain scan, only they have found about that. Only the left can work and right can't work. So she can't do anything, writing or like holding one, anything without a support. She needs a support to walk also. For walk also, she needs a support to eat and everything. It's like cerebral palsy. So sensory disabilities. Amputations in the sense. I have given you the like the definition down here in the notes section, so you can refer to that while you're looking into the slides. I put the definition for you all to like it's easy for you to understand. No, that's what. So amputation in a sense, a surgical or traumatic removal of a limb or extremely like finger, toe, hand, foot, arm, or leg due to disease, injury, or infection. Now, for diabetic patients, if a wound has come in his finger, the finger should has been cut, right? Because the wound will never be cured if the patient has diabetes. So those kinds of patients are related to like amputations. Okay. So sensory disabilities, impairments affecting senses, including blindness, low vision, deafness, and hearing loss. So you know about senses, right? Smelling, hearing, the eye, ear, nose, mouth. Those are there are 5 senses, right? 5 senses, right? Ear, eye, hand, no, hand, skin, mouth, nose, skin. Yeah. So those are like sensory disabilities. So intellectual or development disabilities. So intellectual in the sense it's another word for development. Okay. So conditions impacting learning and cognitive function, such as Down syndrome or severe learning delays. So like dyslexia and dyscalculia and autism as well. Those are some development delays as well. Okay. So mental health condition, disorders affecting like thinking and emotion, including depression, bipolar disorder, and anxiety disorders. So mental health conditions, of course, it includes depression, anxiety, those everything. So neurodevelopmental and learning disabilities, conditions such as attention deficit hyperactive disorder, ADHD, dyslexia, or dysgraphia. Okay, so huh? What? Neuro, yeah, nerves. So physical disabilities. A physical disability is a long-term limitation of a person's mobility, dexterity, stamina, or physical functioning, impacting daily activities. So physical disabilities and the like கை கால் ஏதாவது ஆகுறது உடம்பு ஏதாவது ஆகுறது we can say like. So common types include cerebral palsy, muscular dystrophy, and spinal cord injuries, amputations, and arthritis as well. So causes range from genetic conditions and birth injuries to accidents and illness. So accident like arthritis, amputations, அதெல்லாம் இருக்கலாம். So first physical disabilities. Okay. And yeah, if the father has sugar, the child also. No, right? No, the percentage is like forever. The father, like breast cancer, genetics. Father doesn't have, mother have. Idea. Yeah, sucrose, lactose, fructose. Those are good. Stomach sugar. What? I can't understand. What? Yeah. Yeah, absolutely. இல்ல ஃபேட் இருக்கறனால sugar கம்மி பண்ணா I never heard like that. Starch, fructose, lactose. No, don't ask me about what is like lactose. Those I can't remember. I can't remember those words. But I never heard the. Yeah, no. Like fat food இருக்கறனால sugar கம்மி பண்ணா yeah, other diet problem. அவங்கள வந்து ஒருவேளை ரூம் ஸ்கேன் பண்ணி பார்த்திருப்பாங்க அதுல ஃபேட் இருக்கும் யா டூ மச் சுகர் சாப்பிட வேணாம் லைக் பாம்பிட்டி அது இதெல்லாம் வேணாம் யா ஃபேட் இருக்கறனால அது ஃபேட் இன்னும் அதெல்லாம் சாப்பிட்டா போன்க்கு எஃபெக்ட் ஆகும் தானே அப்படியா இருக்கும். No, no, I never heard of like that. வயிற்றுல சுகர் லைக் ஃபேட்க்கு குறைக்கிறது வந்து பிளட் அதெல்லாம் ஓகே பட் ஐ மீன் ஃபேட்டை குறைக்கிறாவது அவங்க சொல்லியிருப்பாங்க லைக் இவங்க வந்து அப்படி புரிஞ்சுப்பாங்க ஃபேட் குறைய வந்து சுகர் லைக் லைக் உடனே இது பண்ணணும் ரிமூவ் பண்ணணும் லைக் ஈட்டிங் சுகர் அண்ட் எவ்ரி திங் ரொம்ப அது சாப்பிட்டா ஃபேட் வரும் அது ஃபேட் no charger. So we'll do it. Sensory disabilities. Sensory disability is a condition where one or more senses, sight, hearing, smell, touch, taste, or spatial awareness are impaired, affecting how an individual interacts with the world. So these abilities often stem from neurological conditions, example, sensory processing disorder, or physical impairments, example, blindness, deafness that hinder information processing. So sensory disabilities one the condition where one like more senses is affected. Blindness, hearing problems, அப்படி. See here the picture. So in here, the selective hearing, so in her own word, so selective eating and poor diet, so responds adversely to hugs and physical contacts, frequently works on tip and toes. So the other one is difficult in concentrating, sensitivity to loud sounds. So pika in the sense eating objects with no nutritional value, and difficult with fine motor skills, difficult dressing and tying shoes. So for sensory difficulties இருக்கிற பிள்ளைகளுக்கு மிச்சம் loud noises கேட்க கூடாது லைக் அவங்க கேட்க மாட்டாங்க they will act like weird they will like keep like this and tell tell you to go and off that please go and off that அப்படி அப்படி இல்ல லைக் லைக் இப்போ நீங்க ஏதாவது ஷவுட் பண்ணதானே அவங்க ஏதாவது சொல்லுவாங்க இவங்க வந்து ஒரேடா வந்து அவங்களுக்கு காது ஏதாவது பண்ற மாதிரி லைக் they will shout in a bad manner not like the கத்த வேணும் சும்மா இருக்கு not like that they will like keep the hands like this and shout please don't அப்படி என்று yeah they are shouting அப்படி என்று and frequently works on tip and toes so இந்த கால்ல இருக்கிற tip toesக்கு அவங்களுக்கு சென்சரி இது வராது இவங்க நடக்கிறாங்க like this so sensory disability is for that. So developmental disabilities. So developmental disabilities are chronic, lifelong physical or mental impairments originating before age 22, resulting in significant functional limitations in areas like self-care, language, learning, and mobility. So common types include autism, Down syndrome, cerebral palsy, and epilepsy. So early intervention, therapies, and special education can improve long-term outcomes. So development disabilities and a development delay. Okay, so like autism, cerebral palsy, and epilepsy. So their growth of their development is being delayed, right? So the academics part are physical, emotional, அதெல்லாமே delay ஆகும். So அது ஒரு development delay. Okay, so and then Inclusive education. So, inclusive education is a pedagogical approach ensuring all students, regardless of ability, background, gender, or language, learn together in mainstream classroom, receiving tailored support to thrive. So, pedagogical in the sense, pedagogical approaches in early childhood education are specialized methods guiding how educators support learning, focuses on play-based child centers and constructive techniques. So pedagogical approach in the like it's like child-centered one. Okay, child-centered. Pedagogical. Andragogy. Yeah, we learn about that, right? Andragogy is what? Adult-centered. Pedagogy is child-centered. Child-centered approach. Yeah. Like guiding how educators support their learning. Appadi. Okay, so it focuses on removing learning barriers, fostering belonging, and adapting teaching methods to meet diverse needs, moving beyond, moving beyond, moving beyond physical presence to active participation. It shouldn't become there. Sorry, guys. Yeah, fostering. Fostering in the sense like you're supporting him. Yeah. Uh, we can say, yeah, helping. So inclusive education is a child-centered approach, ensuring all students, like regardless of ability, background, gender, or language, learn together in a mainstream classroom, receiving tailored support to thrive. Okay. So importance of inclusive education promotes equity, reduces discrimination, builds belonging. I told you about discrimination, right? Can you remember? Yes, I can remember. Nusra, wait. Nusra,
Yes, please.
discrimination பத்தி சொல்லிருந்தேன் தானே ஞாபகம் இருக்கா?
Discrimination.
Discrimination. I can remember.
No, miss. ஞாபகம் இல்ல.
Discrimination. I can remember. Mhm. No, I don't.
நீங்க அதுக்கு நோட்ஸ் தந்தீங்க மிஸ், நோட்ஸ் தரல தானே?
நோட் தரல, ஆனா இதுக்கு முன்னாடி ஒரு ஸ்லைட்ல அந்த வேர்ட் வந்துச்சு. நான் சொல்லி கொடுத்தேன். அதுக்கப்புறம் நீங்க வந்து நோட்ஸ் எல்லாம் எடுத்து like you wrote about the definition. Yeah, you wrote about the definition. Discriminate panel. Then, huh? What? See. No. Nostra ಇನ್ನೊಂದು ತೇಗಲೆಯಾ
தேடி கொடுத்த நிமிஷம் அது என்ன முதல்ல யோசிச்சேன்.
தேடுங்க எனக்கு ஞாபகம் இருக்கு நீங்க எல்லாரும் லைக் அந்த டெஃபினேஷன் எழுதுக்கொள்ளுங்க. So discrimination is something like judging, judge பண்றது. Whether your age, whether your gender, whether a disorder இருக்கிற அது okay, but you didn't tell the definition correctly, right? So அது வந்து judge பண்றது, judging, discrimination. Yeah, அதான் நான் இல்லைன்னு சொல்றேன். Yeah, that's correct. So reduces discrimination in the sense you have to reduce the way you are judging. So benefits for children: social interaction, confidence building, and peer learning. So this is inclusive education things. Okay, so teacher strategies for inclusion: differentiated instruction, flexible activities, and individual support. Yeah, related to child-centered approach, related to pedagogical approach. Yeah. Child-centered approach. Examples for inclusive education. So large print worksheet for visual needs and extra time for tasks. Okay, so you can see the image. So what makes an inclusive school? The respect, diversity, collaboration, equity, support, and accessibility. Those conversing about one thing, and they are like into a one team, and they are supporting you. Collaboration. Two of them are joining in one. Like as a teamwork, as a team, we can say. And then, sorry, working with families. So importance of family involvement. Parents know child best. Consistency between home and school. Okay, so uh, in schools, you have those parent meetings, right? Where the child's parents come and meet the teacher, right? So those are like working with families, and has a special needs educator, like has a special need teacher, Shadow teachers, you have to have that collaboration, you have to have the teamwork with the family of the child. Like you have to tell the parent, whoever the parent, the mom or dad, you have to tell them about like how the progress of today. You have to update them day by day, and you have to inform them that this should be done, this therapy should be done at home. You have to, yeah, you have to inform that, yeah, you have to tell this child is like work with this academic, work with this maths today, did this today, and you have to improve this. You have to go home and spend with this child like around like 2 3 hours, and play with them, and you have to inform them. Okay. Communication with families. So meetings, progress updates, and shared strategies. Strategies in the sense like techniques and everything. Okay. So supporting parents, guidance, resources, and emotional support. So multidisciplinary teams. What is a multidisciplinary team? Group of professionals supporting a child development. Okay, so team members in the sense teacher, parents, psychologists, speech therapists, occupational therapists, and a doctor. So these are like collaborating into one job to get done. So their job is, however, their job is this kid might like get cured, right? So the first motive, the main motive, the main job, and the main thing that has to be done from this multidisciplinary team is to cure the child, right? They are all together like collaborating as teamwork, and their first motive and their first thing is to cure the child. The first motive is to cure the child. So importance of teamwork, holistic support. What is holistic development? Growth and improvement in the four aspects, right? So better intervention planning. So for an example, child with speech delay receives teacher and speech therapist support. Okay. Challenges in inclusion. So limited resources, large classrooms, and lack of training. So as I told you yesterday, the large classrooms thing, for large, if there is like special need, that is a special, if that is a special need class, and if that is a large classroom, so one teacher can't like into like concentrate into one student, right, one kid, right? So for that there need one by one shadow teachers, right? For each child there should be shadow teachers, right? So possible solutions like teacher training, parent collaborations, and creative teaching strategies, right? And is there anything that you can't understand before going to the activity? Online girls, Nusra and Rista, is there anything that you can't understand?
நான் நோட் எடுக்கிறேன், நாளைக்கு வந்து கேக்குறேன் உங்ககிட்ட டிரெக்டா.
Okay. நாளைக்கு எக்ஸாம் இருக்கு, மறந்துடாதீங்க.
ஓகே, எக்ஸாம் ஃபினிஷ் பண்ணிட்டு தானே கேட்பேன்.
சரி, okay. What about Riska?
Yes, ma'am.
Why you're like so dull?
Yeah, I am sick, ma'am. Fever. That's
What
why I am sick last 2 days.
Oh my
Blood
God.
nose, cough, fever.
So did you go near a doctor and take medicines?
Yeah, I got medicine.
So for that it's not cured, or how? Is it cured? A little bit even?
Now a little bit better.
Okay, then take care.
Yeah, ma'am. I will study.
எக்ஸாம் வரப்பதான் எல்லாத்துக்கும் ஃபீவரா?
Ma'am.
அந்த மத்த கேம்பஸ்ல புள்ளைல எல்லாம் லைக் எக்ஸாம் வரும்போதுதான் எல்லாத்துக்கும் ஃபீவர்.
Please ask easy questions.
ஓகே ஓகே ஓகே
Okay. Okay.
no worries. Huh? Not yet. I didn't have time. Huh? Thursday. I didn't have time. Yesterday I had time, but yesterday I had time, but I was like watching TV. Yeah, the election. Yeah. Okay, wait. Activity. I'll see the chart. Out means not down. Charging is not there. Just go to message. Where's Gino, Misha? Umesha. Umesha and Shimla is not. So tomorrow, 4 of you, right? So 4 papers. Okay. I have to take it now. No. Tomorrow is 6th May, right? Yes.
This activity செஞ்சு photo அனுப்புறேன் இப்ப leave ஆவா
Okay. Activity 2 on say, you know.
okay
1 and 2. Nusra, you Marala? Baby fever. Baby fever. ബേബിക്ക് ഫീവർ ഇല്ല, ബേബി ഫീവർ.
பேபிக்கு விட்டுட்டு வரையில அவருக்கு வீசிங் இது இருக்கு. ஸோ அதனால கொஞ்சம் கஷ்டம். அதனால தான் வரல. அது இப்ப கொஞ்சம் ஓகே ஆயிடுச்சு. அதனால நாளைக்கு எக்ஸாமுக்கு வருவாள்.
ஓகே ஓகே ஓகே.
மேம் நானும் லீவ் ஆகிறவா?
ஆக்டிவிட்டி ரெண்டும் செஞ்சு முடிச்சிருந்தா நீங்க லீவ் ஆகலாம்.
ஓகே மேம். நான்
If you are
கொஞ்சம் லேட்.
well, then go and sleep. It's okay.
ஓகே மேம்,
Okay?
தேங்க் யூ. I
Okay,
will
eat and
send
sleep.
little bit later, ma'am.
All right, no worries.
Okay, ma'am. Thank you.
Okay, bye. Take rest.
Bye. Thank you so much.
Okay. Yeah.